So ma'am, anything in particular जो आप बोलना चाहोगे about cancer to our viewers?
So, cancer is, I would say, it is not something to be scared about. It is just like any other disease. Cancer is a disease which, if it's diagnosed early, then it can be cured. It is one disease which is probably about 60% of the cancers are preventable. So I always call this a preventable tragedy.
क्या causes हैं कि इतना rise हो रहा है आजकल cancer के cases?
Yes, cancer cases बढ़ रहा है.
Does it affect differently on genders or age?
Cancer cases जो होते थे mostly 50 60s में होते थे cancers, most of the cancers. Young में हम लोग नहीं देखते थे cancers. But nowadays you see a large number of patients who are in the younger age group.
मतलब मुझे लगता है ये बहुत डिफिकल्ट वर्क है कि कैंसर का जो न्यूज़ है टू गिव इट टू द पेशेंट सो हाउ डू यू हैंडल इट
Yes, is that when I have to, otherwise also in my OPD, I don't allow any other interventions, no interruptions. Whatever time I have in the OPD, it is totally for my patient. That is generally the first question. Second question होता है कि अब मेरी जिंदगी कितना है? These are the first two questions. And after that comes how much expenses.
आज हम लोग एक और एक्साइटिंग पॉडकास्ट लेके आए हैं और आज हमारे गेस्ट हैं डॉक्टर स्वरूपा मित्रा जो रेडियो ऑन्कोलॉजिस्ट हैं फोर्टिस हॉस्पिटल गुड़गांव में। तो चलिए बातें करते हैं मैम से और जानते हैं कैंसर के बारे में। हाय एवरीबॉडी, आज हमारे पास है, आज आए हैं डॉक्टर स्वरूपा मित्रा एंड जैसे आपको इंट्रोडक्शन दिया था मैम का और मैम से कुछ हम इंटरेस्टिंग बातें करेंगे। तो मैम वेलकम टू आवर शो इन एफसीआर ग्रुप।
Thank you, Millie. I'm so happy to be here. More so because it is so close to my hospital.
Okay. And ma'am, so starting with ma'am, what has motivated you to take this profession?
If you talk of profession, that why I became a doctor, that is probably, my father, he wanted to become a doctor and he had studied MBBS.
Okay.
But because of many family compulsions, he could not complete it. So he had studied almost till the 5th year. So he could not complete it. So that his unfulfilled dream, I being his oldest daughter, he wanted us to become a doctor. So that is probably the initial dream, beginning of the dream to become a doctor. And oncologist, see, at that time, we didn't know what cancer is about. There was no separate subject called oncology.
Right, yeah.
So for us, for me at least, I didn't have any choice. And that time, whatever, according to my rank, whatever seat I got was in oncology.
Okay.
So I took some of my seniors that time said that no, go ahead with oncology because in future, the future years are for oncology.
Exactly.
And you would be probably one of the few lady doctors from Bihar. I belong to Bihar, who would be studying and working in oncology. So that sounded very good. And
that is really inspiring, ma'am, because I also work with doctors and there are very less female oncologists I've come across.
Yes, now there are many, but when we studied, at least in the eastern part of India, there weren't many. There weren't many. In fact, in my institute, I studied from Radium Institute. It was called Radium Institute that time in Patna Medical College. So I was probably the first one in so many years. It is about 100 years old. So I was probably the first lady oncologist from there.
That's great, ma'am. And any particular incidents, ma'am, कुछ ऐसा हुआ जो आपके करियर में बहुत इंस्पायरिंग हो या इम्पैक्टफुल है?
Inspiring, if you say, yes, there's so many. Every patient is inspiring. I always say oncology is a department, a subject, which is very different from other subjects. And because in this, you are with the patient throughout their life. And it's an ongoing journey. It's an ongoing treatment for cancer patients. And you are the only one they cling on to.
Right.
So you become their doctor, their friend, their mentor,
Care, everything.
everything. Even later on, you find them discussing their family problems with, even the dreams with them, with us. So it's a very different branch. And so, being an oncologist, what I have realized from my patients is that life is very, very precious.
Very precious.
When you see a patient and you break that news that somebody has a cancer, that look of devastation, that depression, that helplessness is absolutely heartbreaking. And it is at that time you realize that how blessed we are
How
to be
blessed we
given
are.
that life.
Every day, है ना मैम?
Every
Every
day
day is
you
a blessing.
remember that, yes, that life is beautiful. And then again, when the patient goes back after the treatment with a good report that no, my cancer is in remission now, the smile
The
in their
smile, the
faces, the
happiness.
happiness, the joy, that again reminds you, my God, life is so precious. It is not something which you just throw away.
तो मैम एनीथिंग इन पर्टिकुलर जो आप बोलना चाहोगे अबाउट कैंसर टू आवर व्यूअर्स?
So, the cancer is, I would say, it is not something to be scared about. It is just like any other disease. It is a chronic disease. There is a lot of taboo around cancer. There's a lot of fear. There's a lot of negativity about cancer. I won't say that I don't agree to it. Yes, probably it is true. When we talk about how the cancer behaves, the expenses in cancer, the late diagnosis, the morbidity, the mortality, means how much people suffer. It's definitely, somebody would be very scared. But at the same time, I would like to say that cancer is a disease which, if it's diagnosed early, then it can be cured. It is one disease which is probably about 60% of the cancers are preventable. So I always call this a preventable tragedy.
Okay.
So these are the things, I would like to, I always tell to all the people who are listening to me that cancer is a preventable disease. You can hold it back. And if you get yourself diagnosed early, then the chances of cure are incredibly high.
राइट। एक्चुअली मैम लोग इग्नोर करते हैं या
Yes,
ऑल्टरनेट मेडिसिन्स पे चले जाते हैं
I know.
एंड सो दिस
Yes.
अवेयरनेस नीड्स टू बी देयर
Yes,
एंड
absolutely, absolutely. So, alternate medicines, I have no knowledge about it, but I would always suggest in any medicine where where it is backed by evidence, by research, that is very important. Only those kinds of treatment I would tell my patient to take, wherever it is. But it has to be evidence backed. It has to be some research based. There has to be a lot of innovations in it. Only then you can be very sure that my patient is in right hands.
एंड मैम क्या कॉजेज हैं कि इतना राइज हो रहा है आजकल कैंसर के केसेस?
Yes, कैंसर केसेस बढ़ रहा है, बहुत ज़्यादा बढ़ रहा है। इसका कारण एक है कि डायग्नोसिस ज़्यादा हो रहा है, अवेयरनेस इज इंक्रीजिंग, इसलिए डायग्नोसिस भी ज़्यादा हो रहा है। डायग्नोसिस ज़्यादा हो रहा है मीन्स द नंबर ऑफ कैंसर केसेस आर इंक्रीजिंग। दूसरा है कैंसर की इंसिडेंस, नंबर ऑफ कैंसर पेशेंट्स भी बढ़ रहा है। और व्हाई? बिकॉज मेनी कैंसर्स, इनफैक्ट मोस्ट ऑफ द कैंसर्स आर लाइफस्टाइल रिलेटेड। सो आजकल हमारा जो लाइफस्टाइल है, इट इज westernized.
वेस्टर्नाइज में
And we
फास्ट
try to
फूड एंड
ape
ऑल,
the West.
Copying
So we
them.
ape them, copy them, and we have forgotten our own, which is our own Indian lifestyle. We have forgotten that. So this is one reason that cancer, number of cancer cases are rising so high.
Right. So does it affect differently on genders or age?
Uh, uh, when we were studying MBBS, MD, that time कैंसर केसेस जो होते थे मोस्टली 50-60s में होते थे कैंसर्स, मोस्ट ऑफ द कैंसर्स। यंग में हम लोग नहीं देखते थे कैंसर्स, बट nowadays you see a large number of patients who are in the younger age group. ब्रेस्ट कैंसर पहले 50, 55, 60, 70s में होता था, आजकल हम देख रहे हैं 18, 19, 20 में।
My
So
God.
that pattern has absolutely changed. जेंडर वाइज मेन वुमेन, यस, कुछ कुछ कैंसर्स है जो कि वुमेन में ज़्यादा हैं, कुछ कैंसर्स मेल्स
Men.
में ज़्यादा हैं. इट मे बी बिकॉज ऑफ द लाइफस्टाइल, लाइक टोबैको इज़ अ
Ma'am,
वेरी
heredity also
इम्पॉर्टेंट.
plays a part?
हेरिडिटरी अबाउट दैट, बट हम लोग जितना हेरिडिटरी को इम्पोर्टेंस देते हैं,
Hmm.
10 to 15%
अच्छा, 10 to
are hereditary,
15%.
rest
Only.
are not.
Right.
So rest of them, out of them, about
Hmm.
60% are lifestyle related.
और मैम, over the years how the diagnosis has been evolved, कैसे changes हुए हैं?
Uh, like I said, diagnosis काफ़ी बढ़ गया है. एक तो है अवेयरनेस ज़्यादा हुई है, इसीलिए जैसे ही पेशेंट को कोई सिम्टम्स होते हैं वो जाते हैं डॉक्टर के पास, इसीलिए डायग्नोसिस ज़्यादा हुई है. बट यस, यू आर राइट, द वे वी डायग्नोस, दैट हैज़ चेंज्ड. So
Right.
there are many ways in which we can diagnose our patients. So innovations in diagnosis, in management has changed a lot.
Has changed a
So
lot
obviously we
from,
can diagnose
it's more
patients.
advanced
Well, yeah,
now.
yeah. We can diagnose patients
हम्म.
much earlier.
अच्छा मैम, मतलब मुझे लगता है ये बहुत डिफिकल्ट वर्क है कि कैंसर का जो न्यूज़ है टू गिव इट टू द पेशेंट, सो हाउ डू यू हैंडल इट?
Yes, uh, you're right. पेशेंट जब आते हैं और पेपर्स लेके आते हैं और बायोप्सी की रिपोर्ट, उसी से पता चलता है कि किसी को कैंसर है या नहीं है. एंड आई सी द रिपोर्ट और उसके बाद पेशेंट को बताना कि कैंसर है, इट इज़ एक्चुअली वेरी डिफिकल्ट. इतने साल ऑन्कोलॉजी में रहने के बाद भी आई फाइंड इट डिफिकल्ट. आई हैव टू प्रिपेयर माई सेल्फ. इट डिपेंड्स ऑन who the person is. Many times जो patient आए हैं, he knows, so he's prepared. But most of the time patient does not know, but he has just an idea and he wants to hear from me that no, biopsy report is fine,
इट्स
there's no
फाइन, देयर इज नो
cancer.
कैंसर. हाँ.
But unfortunately, most of the time you have to break the news.
हम्म.
So what I do is that, when I have to, otherwise also in my OPD, I don't allow any other interventions, no interruptions. Whatever time I have in the OPD, it is totally for my patient. So I give them ample time, and especially when breaking the news, I see to it that if they have any, they want to break down, they want to cry, so that should be the place. ऐसा नहीं हो कि ओपीडी में जल्दीबाजी में कुछ बोल नहीं पाए. आई कैन नॉट रिस्पॉन्ड बिकॉज इट्स वेरी इंपॉर्टेंट फॉर द पेशेंट टू ओपन अप.
राइट.
So it is very important. So many times we see, they break down, and the first thing that usually I've seen that, why did it happen to
टू
me?
मी, व्हाई
मुझे
मी.
क्यों हुआ?
हाँ,
Why me?
व्हाई मी.
So that is generally the first question. Second question होता है कि अब मेरी जिंदगी कितना है?
हाँ.
These are the first two questions.
Yeah.
And after that comes how much expenses. इसको ट्रीटमेंट में कितने
कितना
एक्सपेंसेस
एक्सपेंसिव है?
लगेंगे. एंड फोर्थ होता है कि मेरे घर में बच्चे हैं, ये रिस्पॉन्सिबिलिटीज है, अब मैं कैसे करूं. तो जनरली ये चार रहता है, और इन दिस सीक्वेंस. So you need to understand, you have to put yourself in the patient's position and see what they are going through. That means, I too have to go through the same feelings that he is going to. Only then I can help him.
Exactly, ma'am.
So I give them all the time. So many times in the first time, there is the disbelief. They would
The
go
disbelief.
and they'll take more opinions, do another biopsy. That is absolutely okay. I also tell them, in fact, we should tell them, yes, please go ahead.
And do
Go
another
and
one.
go take another
second
opinion,
opinion.
second opinion, third opinion. Unless and until you are absolutely comfortable and you are you are at the, you have understood your disease,
your disease.
you're prepared for the treatment, only then we start talking about the treatment. So
Right.
that empathy, time, patience, empathy, time, patience is required.
वही मैम, मतलब अपार्ट फ्रॉम, मतलब तब आप एक डॉक्टर नहीं रहते है ना मैम.
Yeah,
यू
yes,
हैव टू बी अ
yes.
ह्यूमन फर्स्ट.
See, doctor is later. I think I'm a human being first.
First.
Anybody, I'm a human being first. After that, doctor. Everybody has their own profession. The person sitting in front of me may be an IT professional, maybe a lawyer.
Right.
So everybody has their own profession. So mine is nothing different. So I
Hmm.
am first a human being. So that
Hmm.
in the human to human connection is
Is
needed.
very,
Is
very
needed.
needed.
I have to gain the trust of the patient. Only then the patient will, because the patient is submitting himself to the treatment.
Right.
Is submitting everything.
Hmm.
So I have to gain that trust of the patient.
Exactly, ma'am. मतलब उस time जो mental trauma he's going through, he or
Yes,
she,
yes,
कि family
absolutely,
is there, I
absolutely,
have responsibilities, and
absolutely. And
especially with
just
the younger
going through
people,
something unknown. You
unknown.
don't know what the future holds.
Hmm.
I'm talking on keeping myself on the patient's position.
Hmm.
I just don't know where it is going to go. How
Hmm.
many chemotherapy, how many radiation, what will be the surgery, how my body will change, how my life will change. So you just don't know
No.
anything. How much expenses are sky high
Sky high.
sometimes. So it's absolutely a very different way how to handle the patient. The treatment comes later on.
एग्जैक्टली एंड मैम आप जैसे उनको गाइड करते हो उनकी फैमिली से क्या आपकी एक्सपेक्टेशंस होती है कि नियर एंड
Yes.
डियर वंस या
Yeah.
फ्रेंड्स.
You know what?
हम्म.
The patient definitely goes through the trauma of the treatment,
हम्म.
not only the diagnosis, throughout the treatment, लेकिन उनके जो family members हैं, they need equal attention. In fact, I would say they probably go through a greater trauma
हम्म.
because they are seeing their loved one suffering
सफरिंग.
and she cannot help.
हम्म.
So, that helplessness that the only a family member or the loved one feels. So, if a patient needs counseling, so does the family
सो
member.
डज द फैमिली.
And for the patient, the family member is a moral support. So she needs lot of love, lot of affection, and lot of support from the family members. Again, at the same time, many times the family members are dependent of the patient.
हम्म.
So that time it is again different. The patient had a lot of anxiety. So in so many people, they're dependent on me. How do I do? He has then the anxiety. So it is either way. Both the family member and the patient, their lives are interconnected. So whatever happens to one person, it affects the other
अदर.
person. So family member and the loved ones, they are a support, a wall, a support to the patient.
राइट मतलब उनको इमोशनली मेंटली दे हैव टू
Yes, they
सपोर्ट.
have to support,
सपोर्ट.
although knowing that they are
हम्म.
also going through the same
हम्म.
trauma.
राइट मतलब मैम इट्स
It
वेरी
is very difficult to
वेरी डिफिकल्ट.
express sometimes how they feel. Now that we have seen them, so we experience them every day. So it's absolutely a different journey, a different feeling you go through.
या एंड मैम कुछ मिथ्स है कैंसर के बारे में वो थोड़ा सा हमें बताइए कि क्या लोगों के
Yeah,
मिथ्स है.
yes,
हाँ.
and that is the myths are one reason
हम्म.
that they get diagnosed late.
लेट.
The
हाँ.
first and foremost,
हम्म.
even many educated people, biopsy
इग्नोर
नहीं
नहीं
कराना है.
कराना है.
Biopsy
फैल
नहीं
जाएगा.
कराना, biopsy से फैल
फैल
जाएगा.
जाएगा.
This is absolutely,
मिथ.
absolutely irrational.
हम्म.
Without biopsy, you cannot go ahead with the
हम्म.
treatment.
हम्म.
The biopsy not only confirms cancer, it also
हम्म.
tells you the details of the cancer. Nowadays, you have personalization of the treatment. So every two patient is different. अगर दो पेशेंट ब्रेस्ट कैंसर के हैं, दोनों के स्टेज सेम है, लेकिन दोनों के ट्रीटमेंट अलग
अलग
होंगे.
होंगे.
So this you cannot do unless and until you have the biopsy in your hand.
राइट.
So biopsy is a must. So this is one big myth that biopsy has to be done. It does not cause spreading of cancer.
हम्म.
But yes, it has to be done from a good center.
गुड सेंटर.
Second is, जब मेरे पेशेंट्स का ट्रीटमेंट चल रहा है, घर में सबको पेशेंट के साथ रह सकते हैं
हम्म.
या अलग रहना
हाँ
चाहिए.
हाँ हाँ.
So
अच्छा.
this is also absolutely
Absolutely.
untrue. पेशेंट के साथ रहना, when the patient is undergoing treatment, आप जितना साथ में
हाँ
रहेंगे,
उनको
पेशेंट
सपोर्ट
को
की
उतना
जरूरत है. हाँ
कॉन्फिडेंस मिलता
एग्जैक्टली.
है. पेशेंट से कैंसर फैलने वाली
फैलने
बीमारी
वाला
नहीं
नहीं
है.
है.
जब उसका रेडिएशन चल रहा है, रेडिएशन से दूसरे फैमिली मेंबर को कुछ नहीं
कुछ नहीं
होगा,
होने. हाँ.
बिकॉज दैट रेडिएशन इज नॉट ट्रांसमिटेबल.
हम्म.
सो इट इज, आप जितना फैमिली मेंबर्स, चाहे बच्चे हो, प्रेग्नेंट वुमेन हो, जो भी हो,
कुछ नहीं
साथ
होने.
में रहेंगे, इट गिव्स कॉन्फिडेंस टू द पेशेंट, अ मॉरल सपोर्ट टू द पेशेंट. इसलिए ये मिथ है कि पेशेंट को
ऐसा
अलग
नहीं
रखना है। फिर थर्ड है दैट बहुत समय पेशेंट्स कहते हैं कि बस कैंसर हो गया है, अब तो कुछ नहीं है आगे,
हाँ,
इट इज अ
लाइफ
डेथ
खत्म, इट्स अ डेथ
सेंटेंस।
सेंटेंस, या
It is not. Cancer is like many other diseases. I also tell my patients, yes, many times it is not curable. वैसे if you see heart disease, they are not curable. Blood pressure, diabetes, none of them are curable.
curable,
You have to
live with
be
it,
on a long-term treatment, and yes, you have to learn to live with
live
it.
with it,
So is cancer.
exactly, take
You
with
have
that.
to learn to live with it. So that is what, again, patients, people need to understand. So it is just like any other disease. The only thing is that the earlier you get detected, the chances of getting
Survival,
cured is
it's
much,
much
much higher.
higher. एंड मैम, आपके इतने सालों के प्रैक्टिस के बाद आपने ये देखा है, अगर कोई पॉजिटिव माइंडसेट के साथ रहता है, क्या उसकी रिकवरी फास्टर होती है, ऐसा कुछ है?
Yeah, I don't think there is any study regarding it, but I have seen this, and and many of my colleagues will agree. People who are happy, who are positive, they do much better.
Okay,
They do much
with the
better.
treatment.
Yes, 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 they do much better. On the other hand, people who are very negative, who are depressed,
Hopeless.
they are hopeless, they many times they do not fare well. Like patients who are from the village, they generally don't come and ask many questions, and they just submit themselves. So, and they understand that this is what I have to go through, and they take it in a very matter of fact way. So they do much better.
Right.
Of course, it may be because of their constituent also, their health also, but they do much
Much
better
better, is it?
than
Okay.
we ourselves.
Okay. मतलब मुझे ऐसा लगता है कि हम लोग पास इतना नॉलेज है, एंड देन शायद इसीलिए हम लोग नेगेटिविटी भी पढ़
Yes,
लेते हैं,
yes,
एंड
yes.
देन
Yes, so
इट
there are
इट
studies, in fact, I had also done a study with the Brahma Kumaris.
ओके.
So, उनके साथ हम लोग एक शायद उन्होंने और भी जगह से शायद स्टार्ट किया है that when you do yoga, when you do meditation along with the treatment, so they have shown that the outcome is much better.
Right.
Although it is
Not
yet to be
proven.
proved, but they are doing.
राइट. ओके मैम, फाइनली कुछ आप ऐसे कुछ स्टेप्स बताएंगे टू रिड्यूस द रिस्क ऑफ कैंसर?
To reduce the risk of cancer is one is that healthy lifestyle.
सो हेल्दी लाइफस्टाइल
Healthy
मीन्स
lifestyle means मोटापा कम होना चाहिए,
मोटापा कम.
obesity नहीं होना चाहिए. One. Second is have a lot of fibrous food, lot of vegetables, lot of colored food, lot of fluid in your diet.
ओके.
Third, exercise. At least 30 minutes in a
एवरी डे.
day is dedicated exercise. Fourth is that एक जो भी हमारे country में it is not that relevant, sun exposure should be less. And fifth is that be a healthy and happy person.
Happy person, be a
Happy
healthy.
personality. It is very important to be happy.
Happy.
Happy, positive, and that
मतलब
really
मुझे लगता है
cures
हमारे
half the
सेल्स भी मैम
disease.
रिएक्ट करते हैं ना, इफ यू आर
Yes,
हैप्पी.
yes, yes, you're happy. Yeah, everything around you would be happy,
हैप्पी.
would be positive.
पॉजिटिव.
So, like it said, miracles happen to people who believe in
Who
miracles.
believe in miracles, yeah.
So it's the same thing. So
Faith.
positivity happens to all those who believe in
Believe in
positivity.
positivity, yeah, true, true. Okay, ma'am, thank you so much for your time, and thank you for coming
Thank you,
today.
thank you,
Thank
Millie,
you, thank you.
and look forward to many
Oh,
more
yeah,
such
yeah, yeah,
sessions.
yeah. Thank you so much.
Yes.
Yes, ma'am.